Welcome to the Northeast Connecticut Joint Academy online educational session. The first part of the session will guide you through the process from today through the day of your surgery. Part 2 will focus on nursing and physical therapy care while you're in the hospital, care coordination, and finally, physical therapy at home. On behalf of Hartford Healthcare, thank you for choosing Windham Hospital along with the Center for Bone and Joint Care, where you'll receive expert and compassionate care and where we utilize state-of-the-art robotic arm-assisted technology for your joint replacement. In the photos are Drs. Reagan and Choksi, board-certified orthopedic surgeons, both experts in joint replacement surgery with many years of experience. The gold seal signifies that our program at Windham Hospital is certified as a center of excellence in hip and knee replacement surgery by the Joint Commission of the Accreditation of Hospitals. Our goals for you are to feel more comfortable going into your surgery through education. We'll provide you with quality and comprehensive care to allow you to return to your active lifestyles quickly and safely. It's important for you to set a goal for yourself. Perhaps it's, I want to sleep through the night without pain, be able to walk to the mailbox, walk through the entire grocery store, or it may be a loftier goal, like walking a few miles a day or riding your bike. Whatever your personal goal is, let that guide you through. Total joint surgery is meant to improve your quality of life. Cutting-edge advances make it possible for patients to return to their lives quickly and safely to their own home. In most cases, our patients will be safely transitioned to home the next morning. You must prepare to have a family member or friend stay with you for the first 2 to 3 days for your safety. If you do not have anyone that can stay with you, you'll need to hire a caregiver to stay with you. After the first 2 to 3 days following your surgery, it's acceptable to have someone checking in on you daily. It's also wise to plan ahead for the things you will not be able to do following your surgery, such as your meals, who will do your housework, yard care, pet care, and who will drive you to your appointments. Optimizing your outcome is our goal. We want to give you the tools through education and care so that you have the best possible outcome. We help you to accomplish this through our pre-admission center, where our team will optimize your health before your surgery. Try to maintain good health and nutrition before and after your surgery, incorporating a well-balanced diet including fruits, vegetables, lean proteins, whole grains, fiber, lots of water, and is free from processed foods. Your protein needs will increase during the healing process, so plan to increase your protein post-op. A good idea is to have some protein shakes on hand for when you return home. We'll minimize fasting and dehydration by allowing you to drink some Gatorade or Powerade the night before and morning of surgery. You'll receive these instructions at your pre-admission testing appointment. Do not eat or drink anything other than the Gatorade or Powerade after midnight. We'll use a multimodal pain control regimen. This means we use many different ways to help minimize discomfort. We use the least amount of narcotics or opioids as possible. We'll also give you medication to help prevent nausea. If you know you're prone to nausea after surgery, please let your surgeon know before surgery, as well as at your pre-op testing appointment. Getting you up and walking within 4 hours following your surgery is key to a speedy recovery and will be accomplished safely. All of these things together decrease risks of complication and increase your satisfaction. This is known in the world of surgery as ERACE, or Enhanced Recovery After Surgery. Your pre-admission center testing appointment will include meeting with the nurse practitioner, and anesthesiologist. This may include health history, lab tests, EKG or electrocardiogram, and a CT scan of your joint. Please be sure to bring with you a detailed medication list, including supplements you take. Names of medications, doses, and time you normally take them are important for your care team to know. At this appointment, you'll be told when to stop certain medications and if there's any medication you need to take the morning of surgery. You may do so with a small sip of water or Gatorade. Smoking causes a significant delay in bone healing and is bad for your overall health. It increases your risk of deadly complications such as infection, blood clots, and other complications. Stop smoking. Please be honest with your caregivers regarding your drug and alcohol intake as well. There are serious life-threatening interactions that can occur with medications we use before, during, and after your surgery. Alcohol withdrawal can also be life-threatening if not managed properly, so be honest about your intake. You'll receive instructions at your pre-admission center appointment regarding skin care before surgery. You'll be provided with HebaCleanse Skin Cleanser at your pre-admission center appointment and will receive instructions. This includes washing your body from the neck down. Pay special attention to the area where you're having surgery. It's important to report any rashes, scratches, bites, pimples, or anything else that does not belong on your body or looks infected before your surgery date to your surgeon's office. Ladies must stop shaving at least 3 days before surgery, including hair-removing agents. We will clip any hair the morning of surgery. Do not apply any creams or lotions to the area of surgery. The surgical coordinator from the Center for Bone and Joint Care will call you the afternoon before your surgery, before 4 p.m. This is a rough overview of what you can expect your hospital stay to look like. You'll arrive to the ambulatory surgery unit where you'll check in and a nurse will prepare you for surgery. You'll be in the operating room approximately 1.5 to 2 hours and in the recovery room for a minimum of 1 hour. Then you'll be brought into your private orthopedic room. You may get dressed in your own clothes or pajamas if you wish. The nursing and therapy team will help you do this. Safety permitting, you'll be out of the bed within 4 hours after surgery with the therapy team and/or nursing. We'll do our best to allow you to sleep at night without unnecessary interruptions. If safety permits, you may ask for your door closed. At no time should you ever get up without the assistance of staff. Always call for help. The next morning, the staff will help you get dressed. You'll have therapy sessions and will be visited by your surgeon and/or APRN or PA and the nurse navigator, as well as the case manager who will coordinate your transition to home and arrange your home therapy. Prepare to transition to home between 9 and 11 a.m. Arrange your ride home for during this time frame. Osteoarthritis is the gradual loss of cartilage along the joint margin which results in pain, swelling, and stiffness. You may hear your surgeon use the word osteophytes. This is a medical term for bone spurs. Your body tries to make up for this loss of cartilage by overgrowing bone in the area, a decreased range of motion, and the ability to move. Many factors can lead to osteoarthritis, such as wear, tear, age, weight, heredity, repetitive stress injuries, athletics, and some illnesses, such as rheumatoid arthritis and psoriatic arthritis, for examples. The next few slides will discuss the surgery. At Windham Hospital, we utilize state-of-the-art Mako robotic arm-assisted surgery for our joint replacement patients. The Mako robotic arm is an extension of the expert hands of your surgeon. His hands are on the robot at all times. Your surgeon is still performing your surgery. The Mako robotic system begins with your 3D CT scan. This provides your surgeon with a virtual map of your hip or knee. Through this CT scan and the Mako program, a pre-op plan is determined as to what and how much bone will be removed during your surgery. The state-of-the-art Mako system allows for the accuracy and placement of your implants every time. The surgeon guides the Mako robotic arm during your surgery, and the Mako system assists him in staying within those planned boundaries while allowing for adjustments. The Mako robotic system provides accuracy of within 0.5 millimeters. This all results in a more natural feeling for your hip or knee, more of a custom fit for you. This slide shows an X-ray of a healthy knee on the left and a knee with osteoarthritis on the right. The large bone on the top is the femur or thigh bone, and the bone on the bottom is the tibia. The X-ray of the knee with arthritis, you'll notice the cartilage is worn away and there's bone-on-bone contact. This is also shown in the photo on your right. This is a picture of the total knee implant. The implants are made of a metal blend of cobalt chromium and a type of plastic called polyethylene. Each comes in various sizes and thickness. There is a femoral implant, a tibial implant, a tibial polyethylene insert that fits between the tibial and femoral implants, and finally, a patella or kneecap implant that fits in the inside of your kneecap. Your bone begins to attach to these implants immediately and is fully attached within 6 to 8 weeks after surgery. This slide refers only to those patients undergoing a partial knee replacement. Partial knee replacement is less common and is for patients who typically have arthritis localized to just one area of the knee. The picture on the right is a partial total knee with each implant labeled. The implants are made of the same materials, cobalt, chromium, and polyethylene. The Mako procedure itself remains the same for those patients undergoing a partial total knee and includes the pre-op CT scan to determine a pre-op plan. It's not uncommon for patients undergoing a partial knee replacement to go home the same day, but this will be determined by your surgeon and care team. The next few slides will address total hip replacement surgery. In osteoarthritis of the hip, there is loss of cartilage along the joint margin. The hip joint is a ball and socket joint made of the socket part called the acetabulum, and the ball part, which is the head of the femur, also known as the thigh bone. There is often osteophyte or bone spur formation to make for the loss of cartilage in that area. It's common to have radiating pain to the groin, back, and down the leg to the knee, limited range of motion, and uneven leg length. The X-ray on the left shows a healthy hip, and the X-ray to the right shows a hip with osteoarthritis. It's difficult to determine the margins or edges of the acetabulum and the femoral head due to bone-on-bone arthritis. The total hip implants consist of a titanium acetabulum cup with a polyethylene liner insert and femoral stem implant along with a ceramic metal blend head of the femur. These all come in various sizes. Your bone begins attaching to the implant immediately and is fully attached within 6 to 8 weeks. You'll be instructed on how to maintain your hip precautions in the hospital, at home, and at outpatient therapy as well. On the left is a post-op X-ray of a total knee, and on the right, an X-ray of a total hip. You may set off certain sensitive metal detectors, such as in an airport. You will still be allowed to fly on a plane. Multimodal pain relief refers to the use of multiple different methods of preventing and decreasing discomfort. All patients will have anesthesia. This will be determined by you and your anesthesiologist at your pre-admission appointment. Total knee patients will also have an adductor canal block. This will help to numb the nerves in the knee. During your surgery, you'll have multiple numbing medications injected into your hip or knee. These can last up to 72 hours. You will be given non-narcotic pain medications such as Tylenol and Toradol, as well as narcotic pain medication if you need it. We use a 0 to 10 pain scale to assess any discomfort. You'll also receive medication during surgery to help control bleeding during and after surgery. Whether you're having a hip or knee replacement, you'll have staples. They're removed in about 2 weeks at your follow-up appointment. You'll have a dressing called an Aquacell on your hip or knee that stays in place up to 7 days. You'll receive written instructions regarding this dressing upon your transition home. Call the office with any urgent concerns first. Do not go to the emergency room for anything related to your surgery before calling your surgeon first. If the office is closed, there's always a surgeon on call to ask. Call the office. The answering service will page the on-call surgeon to call you back. This does not pertain to medical emergencies such as, but not limited to, chest pain, shortness of breath, or loss of consciousness. In such cases, call 911.